Time now to get your coronavirus questions answered live.
The number to call, 270-9933. Dr. Zorba Paster standing by at his office in Oregon.
Let's start with Mac in Beloit. Hi, Mac. What's your question?
Oh, what's up, Doc? I just want to let you know I got my first Pfizer vaccine in my left arm, and I was highly advised to go ahead and don't get the second dose in the same arm because there might be a chance of a rash outbreak or something. Is that real deal, or is that just a rumor?
Well, I don't think it really probably makes any difference. You can use the same arm or a different arm. Very common to get some pain and discomfort there, maybe a little rash there, but I don't think it makes any difference. Really up to you whether you want to use that arm or the other arm. And the reality is you might get a reaction the second time. Nothing wrong with the reaction. Remember, you are 10 times more likely to be struck by lightning than you are to have a serious reaction to any one of the shots. And those serious reactions, when they do occur, being extremely rare, basically occur within 15 minutes. Those are 75% of the reactions. The shots are amazingly safe, amazingly good, and amazing to take.
Well, let's go to Art in Marshall talking about masks. Art?
Yeah, Doc, I was just wondering, how can you tell when a mask is time to quit using it or when it's gone past its time to use? I don't use the mask a lot because I don't go a lot of places, but want to know when to throw it away.
Well, first of all, if you're in a regular situation, you're not in a hospital situation, you can just use the mask over and over again. You certainly can wash the mask if it's a cloth mask, or you can get a disposable mask and use that. It's really, the masks have to be changed on a regular basis, really for healthcare professionals. And of course, we have to mask up until the CDC says it's time not to mask up, because that's going to keep the virus from spreading.
All right. Thank you for calling today. Let's go to Paula in Madison. Hi, Paula. What's your question?
Hi, I'm 67, and I just got my first dose of the Moderna vaccine last week. I'm wondering what level of immunity I will have 2 weeks after the first dose, and what your recommendation would be as far as the advisability of being able to go out for a walk or even take short trips to the grocery store.
Sure. Great, absolutely great questions. First of all, if you look at the data for the Moderna and the Pfizer vaccines, the data shows that actually on day 10 or 11, you are about 90% to 95%, really, after that first vaccine. So 2 weeks after the first vaccine, you really are protected. Still means you've got to mask up and use common sense, the common sense that we all know, but you really are protected. So basically, 2 weeks from now or 2 weeks from the vaccine, you can go out. Of course, you can always go outside anytime as long as you mask up and stay 6 feet apart. But going into a store, I definitely think now, 2 weeks later after that first shot, you're safe. But mask up, be prudent. Don't go to the store in the middle of the day if lots of people are there, because you're 65, 67. You're always at the highest risk category. Remember, age is the #1 risk factor for getting a serious, having COVID affect you seriously, needing a hospital visit.
All right, let's go to Lori in Montello. Hi, Lori. You're on with Dr. Paster.
Hello.
Hi, Lori. What's your question?
We had our shot on Monday. On Tuesday, my husband came down with major flu symptoms. Diarrhea, vomiting, couldn't stay out of bed. He didn't get out of bed till Wednesday morning. Should he be getting his second shot, or should he not get his second shot?
Absolutely, 100% get that second shot. And the reason is, it's very doubtful that what he came down with the next day was actually from the immunization itself. I mean, that's usually that is not the most common thing. Could be, probably not, hard to tell. But what I would recommend, because the second shot is really important, is you stay there, not for 15 minutes, but you stay around there for about 30 minutes. Very doubtful that this is going to be a serious reaction, but I think it's very important to get that second shot no matter what, because you really want to be protected against COVID. Little diarrhea, staying in bed, flu-like symptoms, those are very common. COVID, of course, we run a high risk of death.
All right. Thank you for calling. Gina in Madison. Hi there. What's your question?
Yes, I'm a breast cancer survivor, and I was wondering, I was planning on getting the shot in the opposite arm and both shots in the opposite arm. Does it matter?
Yes, it does. And the answer is you should get it in the opposite arm. And by the way, it's fantastic that so many people are calling up and either have gotten the shot or are looking at the shot and getting the shot. Let's just compare that to a few months ago, 2 months ago, even 6 weeks ago, when the shots were not available. It's wonderful. And as you know, or may know, the state of Wisconsin is now beginning to relax who can get the shot. I can't remember exactly what the date is. I think it's April 1st, but don't quote me on that. Where more and more people are going to be able to get the vaccine. It's just amazing. But the answer is yes, in the other arm, not in the arm where I had the breast surgery.
I think that's March 29th, Zorba. Let's go to Mary. One more question in Cuba City.
Mary, are you there? Mary, are you there? I think her question, Zorba, was her son is allergic to latex. Should he get the shot?
Oh, yes, absolutely. Latex allergy is no reason not to get the shot, not at all. And he's not putting on latex gloves or anything else. And the answer is even people who are highly allergic do not appear to have serious side effects from the shot. And that's really important. And that's the good news of the shot. So keep getting shots, folks. You are doing a great job. Let's get more shots, then we can open Wisconsin and open the schools quicker and quicker and quicker.
All right, Zorba, sounds good. Keep up the good fight.
Zorba, thank you so much, and thanks for your calls, everybody. We're out of time. Sorry we didn't get that last caller on the air, but we'll do this again very soon. Zorba, thanks so much. And we'll be right back after the break.
Playback. 3, 2,